Hi, this is How to Write an Assessment Report Part 2. So now we're on writing issues. So you're going to write the report and your interpretations, and you're going to support your interpretations with multiple sources of data, including three big things. Number one, scores from the various tests that you administered. So they all come with standard scoring procedures, except for some of the ancillaries, and I will show you how to score them. This is when your stats class and your research class come in handy. So you'll have to go through that. Two, behavioral observations that you see. So it's very important that you note that all throughout the test, okay? They will tell you about other contexts. So you could have a comparison between what you saw during testing and what they told you about themselves, okay? So that's really important in a court case. If you get a referral that it's a court case where you're looking for competence or sanity or ability to stand trial, things like that. Because what you see at testing is not their mental status at the time of the offense, okay? So you may compare like what you see at testing to what allegedly happened during the time of the offense, and that would be very helpful to a court. And third, historical and background information that you're going to get from their intake, okay? So if they know their previous diagnoses, or they say, oh yeah, when I was a kid, I was a real brat and I did some time in juvie and I scored some wacky number on the juvenile test, whatever. So you may get some discrepancies. You may have someone who scored very high as a juvenile, or previously they were very high in aggression, and you notice that the person in front of you is not aggressive at all. So now you have to write, what accounts for this discrepancy, do you think? Was it just a matter of maturity, or did they have programming, or, they might tell you how, hey, well, you noted that you've had some issues with aggression as a youngster, and you don't seem very aggressive right now. That's my dog trying to tell me she has to go out. She throws herself against the door. Anyway, so you ask them, what accounts for this difference in your opinion? Might not be really what accounts for the difference, but their opinion, okay? So what you're trying to do, keep in mind, you want a very comprehensive picture of that person sitting in front of you, and not just the test scores, unless you're doing that first kind where you're going to just stick to the data. But you're looking to try and get some hypotheses, information, some conclusions, and the type of information that you get is going to vary by the type of test that you do, and the type of referral question, what the person who's making the referral, what they want to know, and what environment that individual is in. So you're going to find all that out in your intake, the type of evaluation. Now some people might say, when I was a kid, I had an individual in class who had a head injury, and so we did some person in class that was using her as a subject did some neurological testing, and they found out very quickly, what part of the brain that was affected, and it was really interesting because she brought in her earlier tests from when she was in the hospital, and it wasn't the same test, but it showed the exact situation. So that was very interesting. So the organization of the report, you have to decide on a basic format. So you can go domain by domain. So you can do intelligence, achievement, adaptive behavior, social and emotional function. You can go domain by domain. You could go ability by ability, intellectual functioning, reasoning, visual spatial, memory, expressive language, articulation, visual motor type skills, so you can do it that way. You can go test by test, so you can compare. I did the Rorschach on person 1 and the Rorschach on person 3. How did that vary from the two different people? Or you can look at one person and like if you said, I did 5 different tests on this person, 4 different tests on this person, how did they do on each test, and were they comparable to each other? So you have to figure out how you're going to do your basic format. Use subheadings. Nobody wants to read a full report with no subheadings. It's like your research report. You're going to start out with a global picture. You're going to become very focused, and then you're going to go global again to try and generalize from your test scores, okay? So global to specific, and then specific back to global. Move from the standardized scores to what does it mean? So we go from standardized to informal. Use your global themes to organize your assessment report, and use contrast to organize it. If you did several different types of depression indexes or aggression indexes or projective tests, so you want to look at if there were differences, why were there differences? Is it the test? Is it the person? Is it the time of day? What is it? Okay? So were there common findings? Do you have data to support that? Were they contradictory? And if they were, why? Okay? Focus on the person, not just the test scores. The test scores are important, and the test itself will tell you what the test scores mean, but you got that person right in front of you, and they're going to tell you their history. So focus on them, not just the test scores. The test scores are part of it, not the whole enchilada, okay? Describe exactly what the person could and could not do. This is especially true if you're going to do grandma, and grandma's had, some strokes or something like that, or someone who could not perform a test, okay? So there's a test called the Cognitive Linguistic Quick Test, and it is not quick. But there's a lot of different subtasks on there, and some of them are quite challenging, and people with different types of diagnoses have a difficulty on some of them. And this is also people with dementia, okay? They may have problems verbalizing different things too. So it's very interesting to do, if you do a family member who you know has had some sort of cognitive issue, the dog, or stroke or dementia or something like that, that can be very interesting. Make sure if you do that, though, that you select a test that's not beyond their ability. That's another important thing. Select a test that is not beyond the person's ability. So if you're going to do grandma or grandpa, that's important, okay? Well, you're not going to do children, but if you did children, you want to make sure that it's not above their ability. And again, you want to report scores that are easy to understand. I'm already impressed with you. You don't need to impress me. Short and sweet, direct and concise. Those are the things that you need in your report. Don't go pontificating or something that's beyond what the data is telling you. Other things, diagnostic issues. So your diagnostic impression, as well as a summary section of what, sometimes they have them and sometimes they don't. Again, you have to decide if it's something that you want to be subject to cross-examination. You may write assessment reports, and this is more common than not, assessment reports that never leave the agency. They're never subpoenable, and it never appears to a court, in front of a court. However, there's always the possibility that they are subpoenable, okay? That person can get into a scrape that has nothing to do with their diagnosis. Maybe they're in a car accident, and they're in court, and they're trying to tell something about the car accident. And the opposing attorney says, well, you can't trust them because they have this diagnosis. Then, all of a sudden, out of something as far afield as a car accident, your assessment report can get dragged into court. So you have to really be professional, concise, and direct, okay? So that's very important, okay? So you want to incorporate what is in that person's intake and what the person is facing now. You're going to ask them in your intake, are they having any difficulties currently? And it's COVID. Everybody's going to have difficulties, okay? We're in a very interesting time in our country, and you may have people with COVID depression. That's a thing now, COVID depression, and stress and anxiety and things like that, especially if they've lost their job or something like that. So you could find a plethora of things. I have to make sure I put enough anxiety assessment tools for you to use in there, because you'll probably have a lot of anxious people in there. Okay, so if you're going to write a diagnostic impression, remember that's not a diagnosis, it's just an impression. So describe the data that support your impression, okay? If you're going to do a diagnosis, describe what supports that diagnosis, okay? Provide enough information to support that conclusion. You just can't say, well, that's what I think. No, that's not going to hold up in court. You get thrown out. It's not going to work. If you're going, when you back it up with a diagnosis and you say, okay, it meets 5 of the 7 criteria, that's enough for a diagnosis, you need to put the diagnostic code in there from the DSM, okay? You have to consider the setting that takes place in, okay? Where are you doing the testing? What is the individual facing? Is it a particularly stressful time for them? Are you in the middle of midterms and you're doing this, or final exams? Because that could make a situation even worse. Okay, that's why it might affect the way they're testing. They might be more anxious or more nervous or whatever. And your qualifications, do you really know what you're doing when you select the test that you are selecting? And that's something I'm going to be looking for, like, what are you selecting to assess this person? And you're going to have, make recommendations for a treatment plan and a referral for that person, okay? Again, it has to be written in understandable terms, okay? That's very important, okay? You don't want to be too vague, because the court doesn't like that, and neither do other clinicians. You also want to keep in mind that it's who it's going to be shared with. Are you writing it for, the court, for a mental health agency? Don't make it too complex. Don't make it too verbose. Don't make it too lengthy. Don't make it inappropriate for the person's age or ability level. Make sure that the person who's getting this can understand it so they can implement what you're suggesting. They may not use it because it's too complex what you wrote, or it's too time consuming. You have this big treatment plan and it's beyond their ability, and the client might have a say and say, no, I'm not going to do that, okay? This is what you recommend, but no, I don't want to do it. So I did list a lot of do's and don'ts, and please pay attention to that. Don't ignore the findings don't integrate the findings from a later section into an earlier section. Save it all for the later section. You want it to flow continuously in time based on how you did the assessment. Don't ignore the big question that the referral is asking, and in this case it's, what are you finding in your assessment, for educational purposes. Make smooth transition, make sure the report is logical, concise wording, don't get too wordy, don't try and impress, but you want to be formal, but you don't want to be so formal that nobody understands what you're talking about. Avoid redundancies and circumlocutions. You don't want circular logic, okay? Keep everything short and sweet. That's the best. Use short paragraphs. Don't use acronyms, or if you're going to use acronyms, write out what they are, and then you can use the acronyms. TOM, like TOMM, test of mental malingering, you're going to write that all out, and then you can use TOM. Avoid colloquialism, like don't say flipped out, swinging from the chandeliers, or JPN, just plain nuts. That's not good. Okay, so don't use any of those colloquialism. And don't sugarcoat it. Just say it in blunt, concise, real terms. Don't use foreign terms like c'est la vie, sans fait accompli, or done deal, or whatever. Okay, don't use any of those. Use correct grammar, punctuate appropriately, complete sentences, that's a good thing. Stick to a tense, past, present, or future. Stick to one. Find one and be married to it. Don't flip around and change. That's true for any kind of report that you write. So you want to make sure that the organization is helpful for the reader, whoever's going to be reading it, that it's helpful. So have a table of contents and have your report. Again, you're going to use pseudonyms for your individuals. And you can use any kind of pseudonyms that you want. Okay, make sure they're clean, they have good face validity, they look good, they look professional. Make a rough draft. Go back and listen to your recordings. Incorporate different things. Don't string behaviors together without interpreting them as you go along. Okay? And don't have a bunch of hypotheses without a bunch of behavioral examples. So do discuss their physical appearance, eye contact. Are they paying attention? Are they engaged? How do they respond to success? How do they respond to failures, things that they can't do on the test? What is their attention span like? Are they impulsive? Can they problem solve adequately? Do they become frustrated with themselves? What kind of mannerisms or tics or habits that they have? You have to put all of that in there. Okay, I'm going to stop this here, and I got one last little section, and I will do that next.